implants. We have already discussed till bone density. Now I'll be telling you about the principles that we follow. The principles that we follow for implant placement. At what positions the implant should come. So we'll be discussing that now. Okay. If you have any doubts, anything you want to discuss from the things we have discussed already before, you can ask me. So see, so it's very important whenever you have a patient of an implant, you should know at what all positions you have to place an implant. Suppose there is a patient with 3 missing tooth. So you need to understand and know कि किस place पे the implant should come and how many number of implants are actually required in that particular patient. So basically there are 4 principles. The first three are the most important that you need to understand. The first principle is over an implant you should not give any type of cantilever. No cantilever over implants. The second principle is no 3 adjacent pontic. It means in between 2 implants, maximum 2 pontics are allowed, not more than 2. 2 pontics should be given. The third principle is a canine molar rule. A canine molar rule means whenever a canine or a molar is missing, it cannot be a pontic, it cannot be a cantilever, there should always be an implant below it. Okay. So let's understand these principles one by one. The first is no cantilever. So you cannot give cantilever over an implant. For example, a patient has a missing first premolar, second premolar and a first molar. But you see on a first molar the bone is less. Maybe the nerve is too crestally present or the sinus is too pneumatized and you're not able to place an implant in first molar. So you cannot just place implants in premolars and can give a 3-unit bridge. You need to place an implant below a molar also. Whether you do a grafting, you do a sinus lift, you do anything, but you cannot give this as a cantilever. So the first principle for implants is no cantilever over implants. Why we do not give cantilever? So they can give you this equation in exam because there is a principle known as mechanical advantage. So they can ask you a question, what is mechanical advantage for implants? तो वो आपको एक equation देंगे and they can ask you what is the mechanical advantage for this condition. So mechanical advantage is the distance of cantilever arm divided by the distance between 2 implants. So in this case, the cantilever arm is 20 millimeters. So we can see this is 20 millimeters, the cantilever, divided by the distance between 2 implants, that is 10 millimeters here. So 20 divided by 10 equals to 2. So the mechanical advantage in this case is 2. Okay, so if they ask you a question, what would be the mechanical advantage? So whatever is the cantilever arm divided by the distance between 2 implants would be the mechanical advantage. Now they can also ask you a question, how much force would be applied on the mesial most implant or the distal most implant when the patient chew. They can ask you this question. Okay. So now the force depends upon the mechanical advantage. So suppose karo, the patient bites with a force of 25 pounds. The patient bites with a force of 25 pounds. Now this 25 pounds force into mechanical advantage, which is 2 here, will be the amount of force that would be applied on the mesial most implant. Now this 50 pounds plus 25 pounds, the sum total of these 2 forces will be the amount of force that will be applied on the distal most implant. So there are multiple type of MCQs they can ask you from this image. They can ask you the mechanical advantage. They can ask you the amount of force that would be applied on the mesial most implant or the distal most implant. So you should be able to solve all the different types of MCQs just by calculating the mechanical advantage. Now similarly, no cantilevers should be given. No cantilevers. This is also a cantilever. See, you know your implant should be placed at a distance of 2 mm away from the natural tooth. In this particular case, you can see the distance between your implant and the natural tooth is around 8 to 10 mm. This is because the first position of the drill, where the drill was positioned, is not correct. So that is why, can you see this implant fractured? Because once that occlusal load came over that implant was not able to bear it up and the implant fractured. So also, cantilever does not only mean this, that you are giving an crown over the implant and that crown is overhanging. This is just not the type of cantilever. This is also a cantilever where the position of the implant is not correct. The position is far away from the tooth, and due to which the excess force that came over the implant leads to the fracture. Okay. So anyhow, please make sure when you position the first drill, how do you position the first drill? You position the first drill by keeping the drill at a distance of 2 mm plus the radius of the implant. So suppose my implant diameter is 4 mm. So 4 का आधा कितना हो गया 2 plus the distance from the tooth 2 mm. So I'll position my first drill at 2 plus 2 4 mm. When I do so, when I drill, I'll be able to place my implant at a distance of 2 mm from the adjacent tooth. Now what could have happened in this case is, right now I can see the distance to be around 8 millimeters. So the surgeon who drilled and placed the implant, so 8 plus the diameter radius of the implant means 2. So the operator placed the drill at a distance of 10 millimeters from the adjacent tooth. So that is why this 8 millimeters of distance was left between the implant and the natural tooth. Okay. So very important that the first drill is positioned. They can ask you a question that at what distance, if you want to place an implant of 5 mm diameter, at what distance from the adjacent tooth you have to position the first drill. So 2 mm plus the radius of the implant means 4.5 mm from the adjacent tooth. Okay. Now no cantilevers. If the sinus is near, you need to do a sinus lift, but you cannot just give a crown hanging over one implant. No cantilevers. No cantilevers of any type. The second principle of implants is that no 3 adjacent pontic, means between 2 tooth or 2 implants, generally over 2 tooth also, in between 2 tooths, 3 pontics are not allowed. Similarly, because what happens, as the number of pontic increases, the amount of force on the abutment implant or the tooth increases multiple times. The amount of force will increase multiple times. So now if you can see, 1 pontic is allowed, 2 pontic is allowed, but 3 pontic over implants is not allowed. So this is okay, but more than 2 is not allowed. The third principle is a canine molar rule, a very important principle. This principle states that whenever a canine or a molar is missing, it should always be replaced by an implant below it. मतलब वो कभी भी pontic या cantilever नहीं हो सकता. So now suppose, let's take some examples. They can ask you questions by giving examples. एक patient है, उसमें ये 4 teeth missing है. Tell us the position and the number of implants that are required. So that they can ask you these type of questions. So now if you see this, 3 teeth are missing. So you have to apply all these 3 principles in a sequence. The first principle is that no cantilever. So I'll have to place 2 implants. One in lateral and one in first premolar. तो पहला principle तो ये follow हो गया, no cantilever. Second principle is no more than 2 pontic. तो 1 ही pontic है तो कोई दिक्कत नहीं. But the third principle states that canine and molar cannot be a pontic. It means you'll have to place an implant below a canine also. So it means for replacing these 3 teeth, you'll require 3 implants. So this is how you follow the principles. Now again, next example. 3 teeth, first principle no cantilever, so central incisor और canine पे 2 implant आ गए. Second principle is no more than 2 pontics, only 1 pontic. The third principle is a canine molar rule. So canine molar पे भी implant पहले से, so 2 implants in this case is sufficient. So this is how whatever condition you get, whatever OPG they share you on your during your exam, you can just apply these 3 principles in a sequence to get the answer. Okay, now they ask you one more question. Suppose you are doing a full mouth case. Your anterior implants, so these two are anterior implants. So इसे एक hypothetical line pass कर देते हैं. This is known as anterior line. And similarly आपके पीछे के जो दो implants हैं इनसे एक posterior line spread pass कर देते हैं. This is just hypothetically seen. So the distance between these anterior line and the posterior line is known as AP spread, anterior posterior spread. Now they will ask you a question. In a full mouth case, if you want to give a cantilever, how much cantilever can you give? So the answer for this question is whatever is your AP spread into 1.5 times. Suppose my spread, AP spread is 5 millimeters here. So 1.5 times of 5 millimeters means 8 mm approximately on each side I can give a cantilever. So 8 mm crown here, 8 mm crown here. So whatever is your AP spread, suppose your AP spread is 10 millimeters. So obviously 10 millimeters ka 1.5 times you can give crown cantilever on both the sides. But this is just for full mouth cases. तो अगर आपसे पूछते हैं full mouth case में AP spread का क्या फायदा है, it helps you to understand how much amount of cantilever is permissible, and the value is 1.5 times of AP spread. ठीक है? Now suppose you have a case where your first molar to first molar is missing. So how many number of implants are required और कहाँ कहाँ पे इम्प्लांट डालने होंगे? तो तीनों प्रिंसिपल लगाएंगे. पहला प्रिंसिपल क्या था? नो कैंटिलीवर. सो द फर्स्ट इम्प्लांट वुड बी एज फर्स्ट मोलर ऑन ईच साइड, 2 इम्प्लांट्स. और कैनाइन पे 2 इम्प्लांट आना ही है, कैनाइन मोलर. सो 4 इम्प्लांट तो कंपल्सरी है. फिर देर आर 1 पॉन्टिक, 1 2 पॉन्टिक, तो यहाँ पे इम्प्लांट की जरूरत नहीं है. दीज आर एक्स्ट्रा इम्प्लांट्स इफ रिक्वायर्ड, जरूरत नहीं है आइडियली. बट यहाँ पे 1 2 3 4 पॉन्टिक्स हैं, सो आई रिक्वायर 1 मोर इम्प्लांट. सो आइडियली you will require 2 implants in first molar, 2 implants in canine, and 1 implant in incisor. So 5 is the minimum number of implants that you would require for a case like this if you want to rehabilitate it first molar to first molar. Similarly, if it is second premolar, first molar, second molar. So आपका पहला प्रिंसिपल नो कैंटिलीवर, तो 2 इम्प्लांट आ गया. और कैनाइन मोलर रूल की वजह से, बिकॉज ऑल द मोलर्स कैन नॉट बी पॉन्टिक, सो 3 इम्प्लांट्स आर रिक्वायर्ड. सो जस्ट फॉलो दीज प्रिंसिपल्स एंड यू विल गेट द आंसर हाउ मेनी नंबर ऑफ इम्प्लांट्स आर रिक्वायर्ड. नाउ दे कैन गिव यू दिस इमेज. आई कैन आस्क यू व्हाट इज दिस. दिस इमेज सेज, जो अभी मैंने आपको प्रिंसिपल बताया, इसका क्रक्स क्या है मोटा मोटा, कि इन ये आपके अपर मैक्सिलरी आर्च को, आपके अपर मैक्सिलरी आर्च को 4 एरियाज में डिवाइड करा है. द फर्स्ट एरिया इज योर प्रीमोलर एंड योर मोलर, द सेकंड इज योर कैनाइन, द थर्ड इज योर इंसाइजर्स, द फोर्थ इज योर कैनाइन, एंड द फिफ्थ पार्ट इज द मोलर्स एंड प्रीमोलर्स अगेन. अकॉर्डिंग टू दिस प्रिंसिपल, ईच ऑफ दिस पार्ट, ईच ऑफ दिस पेंटागन शुड हैव एटलीस्ट 1 इम्प्लांट. सो अगर मेरे को फर्स्ट मोलर तो फर्स्ट मोलर देना, वही हो गया, फर्स्ट मोलर पे 1 इम्प्लांट, कैनाइन पे 1 इम्प्लांट, 1 implant in the incisor, canine, and 1 more implant, and first molar पे 1 more implant. So 1, 2, 3, 4, and 5. These 5 implants are required. Okay. So ideally, if I say, they can ask you a question: what are the minimum number of implants that are required? So in mandibular overdentures, you need at least 2 implants. In maxillary overdenture, you need at least 4 implants. In maxillary fixed, you need 4 to 8 implants. Range is minimum is 4, maximum could be 8. Similarly, in mandibular fixed, you need in a range of 4 to 6 implants. So they can give you this question also to you. Okay, now the safe distance. The safe distance, the minimum number of distance between your implant and the natural tooth should be between 1.5 to 2 mm, 1.5 to 2 mm के बीच का distance होना is compulsory. Okay. Now, okay. Similarly, the distance between two implants should be at least 3 mm. दो implants के बीच का distance should be at least 3 mm. So, implant to natural tooth is in a range of 1.5 to 2 mm, and inter-implant distance should be minimum 3 mm. Okay, inter-implant should be minimum 3 mm. On the buccal side, at least 1 to 2 mm of bone, and similarly on the lingual or palatal side, 1 to 2 mm. Minimum is 1 mm. So buccal or lingual पे 1 mm की bone तो minimum चाहिए, but ideally 1.5 to 2 mm is something good. But minimum पूछेंगे तो 1 mm की bone buccal और lingual side पे भी होनी चाहिए. Now they can give you these type of MCQs. They can ask you, suppose there is a patient in which 3 teeth are missing, and all those 3 teeth are to be replaced by 3 implants. The total mesiodistal edentulous space is 22 millimeters. If the size of all the 3 implants would be same, what would be the size of each implant? They can ask you this MCQ. तो अगर आपको मैं बताऊं एक तरीके से implant to natural tooth is 2 mm, inter implant is 3 mm. ठीक है, सो इम्प्लांट के नेचुरल टूथ के यहाँ पे 2 mm, इंटर इम्प्लांट 3, इंटर इम्प्लांट 3, फिर इम्प्लांट नेचुरल टूथ इज 2. सो ये डिस्टेंसेस तो हम कैलकुलेट करके हटा देते हैं. So 2 plus 3 5, 5 plus 3 8, 8 plus 2 10. So 22 में से 10 mm हट गए तो कितना बचा 12 mm. Now we'll have to place 3 implants in this 12 mm of mesiodistal space. So 3x equal to 12 means my each implant could be 4 mm each. Okay, so this is how you can calculate whatever calculations he gave you. Just first remove the safe distances and then decide what is the maximum size of the permissible implant that is required. ध्यान रखना, दो इम्प्लांट के बीच का मिनिमम गैप शुड बी 3 mm, बट द मैक्सिमम शुड बी 15 mm. मैक्सिमम 15 mm, 15 mm से ज्यादा नहीं हो सकता. इट शुड बी maximum 15 mm, should be less than 15 mm. The minimum should be 3 mm. Okay, now the safe distance from inferior alveolar nerve, the safe distance from inferior alveolar nerve should be 2 millimeters. Similarly, from mental foramen, because in a mental foramen there is a loop that travels in a forward and then in a backward direction, and that loop is around 5 millimeters. So whenever you want to place an implant nearby, the safe distance from this nerve is 5 millimeters. Similarly, from the nasal floor it is 2 mm. The minimum bone around the implant is 1 millimeters. If they ask you the distance from the maxillary floor of the maxillary sinus, so you can engage the cortical bone of the floor of the maxillary sinus. It's not necessary to keep a distance of 2 mm, 3 mm, because I have read some books. They say you need a distance of 2 mm, so there is no such distance. You can place your implant touching the floor of the maxillary sinus. It is not a problem. Okay. Now they can ask you one MCQ. What is a jumping distance? So jumping distance, when you do an immediate implant, your socket is big and your implant is small. So the distance between your implant and the bone, when you place that implant immediately, is known as the jumping distance. So suppose I'm placing a maxillary central incisor immediate implant. I have placed an implant of size suppose 4 mm, and I can see my implant is at a distance from the labial plate. This labial plate, this distance approximately, if it is 1.5 to 2 mm, I can say this jumping distance is 1.5 to 2 mm. Okay. Now, please remember, when you are placing mandibular anterior implant, so they can ask you one MCQ, which artery can be damaged if you perforate the lingual cortex. So can you see the direction of this drilling? This is the sagittal section of lower anterior or the lower incisor. if the drill perforates the lingual cortical bone, like you can see at the arrow. So the branch is ascending branch of sublingual artery that can be nicked, that can be damaged, and it can lead to massive bleeding, and it can lead to a problem that is known as a sublingual hematoma. So they can ask you this question: what is sublingual hematoma? So this is the ascending branch of sublingual artery which can get nicked when you are drilling and you perforate the lingual cortex, and your patient may report with this condition. So if your examiner gives you this image and ask you, what is this? So you need to answer this. This is sublingual hematoma, and it can happen due to damage to the ascending branch of sublingual artery that is present on the floor of the mouth. Okay, so they can ask you, when you're placing lower anterior implant, what needs to be taken care of. So you need, if the option is, need to prevent sublingual hematoma by preventing any injury to ascending branch of sublingual artery, and this can be prevented by prevention of the perforation on the lingual cortex. Okay, and this may even lead to, they can ask you what can it lead to. It can lead to asphyxia. It can raise the floor of the mouth, the tongue, and the patient can have difficulty breathing. It can even lead to ecchymosis on the chin, because that bleeding is not stopping, and that blood, that hematoma has happened on the chin also. So it can lead to severe hematoma. So whenever you're placing the implant, they can ask you one more MCQ: how much distance should be kept from the root of the adjacent tooth? So please remember, when you are drilling and placing an implant, you need to be away from the adjacent tooth root. Now, how far? You need to be far to the distance of the periodontal ligament width. The width of the periodontal ligament is between 1.3 to 1.3. So ideally, if I say, you need to be at a distance of at least 1 to 1.5 mm away from the root apex, also away from any place in the root, to prevent any damage to the adjacent tooth. Okay, clear? So stay away from the adjacent tooth. Don't go into the PDL space also of the adjacent tooth. Now, if you see this picture, what has happened to this implant? The angulation of drilling is wrong. The hand was too lingual from the top. So what happened? From the apex, the buccal bone was perforated. Similarly, in this second implant, the drill direction was too buccal, so that the buccal labial bone was weakened. So it means, when the angulation of your drill is not correct, the cortical bone becomes weak, and it can lead to perforation of the cortical bone on one of the sides. Clear? Now, what do you see in this image? They can ask you this MCQ. You see that the implant is very near to the inferior alveolar nerve. A safe distance of 2 millimeters should be there between your implant and the nerve. Okay. Now they can ask you, what is this? This is submandibular fossa region. Now what they can ask you, one MCQ: what is the clinical significance when you are drilling or when you are placing your mandibular implant, molar implant? So when you drill for your mandibular molar implant, if you get a drop, they can ask you an MCQ: why this drop has happened? Because you are into the submandibular fossa region. So for drilling in a mandibular molar, there are two things that you need to remember. First, stay away from the nerve, and second, you don't drill in such a way that you are into the submandibular fossa region, because it's a concavity where the submandibular gland is present. Okay, so these are two important things that we need to remember. Clear? Now they can ask you an MCQ: what is the recommended size of the implant in maxillary tooth? So I have given a chart that when I am placing an implant in a maxillary central incisor, the size range is between 3 to 4 millimeters, and the preferred diameter is ideal 3.5 or 4 millimeters. Similarly, for a lateral incisor, it is in a range of 3 to 3.5 millimeters. This is the width. And the ideal size is 3.5. अगर आपको range मिलती है, you can select a range. If you get one option to choose, this is the best option to choose also. If it is canine, it is 3.5 to 4.5 and the preferred is 4. If it is premolar, 3.5 to 4 and the preferred is 4. If it is molar, 4 to 7 and the preferred is 4.5. Now similarly for a mandibular incisor, the range is same, सब जगह same है, बस mandibular central incisor is smaller as compared to maxillary central incisor. So the range here would be 3 to 3.5 and the preferred diameter is 3.5. The rest, the sizes are same. Is it clear? So that's all for today. We'll be discussing next the drilling protocols for implants, because they're asking a lot of questions how to drill, what are the drills, how much to drill. So we'll be discussing that part in the next part of implants. I think that would be the last part of implants. We'll be covering all the rest of the portion of the implant in the next class. Thank you so much.